The crying goes on for hours. This baby boy was born addicted to prescription pain medication. That high-pitched, gasping for breath scream is just one of the telltale signs.
Over the last decade, the amount of drug overdoses in the U.S. has continued to increase. With that, the amount of babies born addicted to drugs has more than doubled.
During our sexual development part of the course, we talk about fetal alcohol syndrome, and along with fetal alcohol syndrome, I also teach the effects of different types of drug and drug use effects on the fetus. And so, even though we don't by name mention that particular, we do talk about the possibility and the probability of many kind of birth defects because of the drug effects of, again, we talk about the effects of cocaine, marijuana, methamphetamine, all have very negative effects, including alcohol. During the curriculum, as we go to the drug chapter, we talk about medicine briefly, but then street drugs, and we're able to delve a little further on the developmental problems that those drugs cause to a developing fetus. And the way we relate it is what can happen to an individual as an adult is magnified tenfold on what's going to happen to a developing fetus. So again, we talk twice during the curriculum. We talk about how drug use can negatively affect a developing fetus.
Neonatal abstinence syndrome is a group of problems that occur in a newborn who was exposed to addictive opiate drugs while in the mother's womb. Some common drugs that women take in are heroin, codeine, oxycodone, and methamphetamines.
Symptoms of the neonatal abstinence syndrome. Infants can have tremors, seizures, anywhere from yawning constantly to sneezing constantly. It really just varies on each infant. Most of the infants show like high-pitched crying, and it's like not like your normal crying. It's a very different high-pitched noise that you can't comfort them at all. And these can go on just depending on how much drugs the mothers took during the pregnancy. Always know that infants are going to be born drug addicted, because a lot of times the mothers won't let their doctors know, and when they come in to have the infant, they may not be on drugs currently at that time, and so usually they find out if the mother hasn't already shown that she's been on drugs is they drug test all of the placentas and for toxicity and stuff like that to make sure that the infants don't have any other things going on. Protocol for treating these infants is they do a scoring depending on their symptoms and stuff, and depending on their scoring number is how they treat them. They usually treat them with methadone, morphine, or phenobarb. So it's all just dependent on just how their scoring goes, and as the infants are farther out from birth and stuff, their scoring usually goes down, and you see less and less times where you have to treat them. A lot of times the mothers are already in treatment programs. If they're not in treatment programs, they can be placed in treatment programs, and if they refuse to be in like some kind of treatment program, a lot of times the children don't go home with the mothers. They become part of a foster care system, but the overall goal is to have the infant go back to the mother when she's well enough to take care of the infant and show that she can remain drug-free. At this time, they're really not 100% sure of the outcome of these infants as they grow. Most of the time, if they do have problems, they're some kind of neurocognitive disorders, which involves from just being slow learners or having hyperactivity disorders and things like that is what you would normally see.
If we want to decrease the number of infants born with neonatal abstinence syndrome, we have to start educating our youth in school at an early age. Also, with the help of posters and informational pamphlets in hospitals and clinics, we can inform the public on this growing issue and create awareness for babies born addicted to drugs.